Selamat sejahtera, peace be upon you. Ladies and gentlemen, welcome to Lab Asia 2022 seminar session on Rapid Chinese Medicine Authentication using Tcm, Materia, Medica, Ftir, Digital Library. Before we start our session, there are a few rules that we have to adhere. If you have any question, please wait for the Q&A session or do list them down at the Q&A box. If there's any internet disruption during the session, kindly be patient and try to sign in again. In this session, we have Dr. Yi Kai, Material Characterization Principal, Product Specialist from PerkinElmer Malaysia Sdn Bhd. Without further ado, let's welcome him today.
Good day, everyone. I'll be talking about how to authenticate the traditional Chinese medicine using the Tcm Material Medica Ftir analyzer with Digital Library, together with the corresponding sample preparation. The content of this presentation covers the Tcm background, reason why rapid Tcm analyzer is crucial, statistical data of tested samples, reasons that cause poor identification matching, sample preparation guideline, retest result, and also supporting materials available. FTIR methods have been widely used for herbal authentication of herbal products, plants or medicines. The herbal medicinal effects of Chinese Material Medica, CMM, are believed to come from multi-components, not limited to single compound. Therefore, quality control methods depending only on a few index components do not represent the holistic fingerprinting of the samples. Furthermore, different kinds of CMM with similar components are difficult to be discriminated by the non-holistic fingerprinting. For example, ginseng and noto ginseng and licorice or Glyceria ulariensis in the market. In addition, other analytical identification is too complicated and required skilled person to operate. Thus, we're promoting the simplest way by using FTIR methods for herbal authentication of herbal products. The FTIR CMM library contains 573 commonly used CMM spectra, useful applications in many fields such as research, industrial quality control, and also teaching. The CMM spectra were developed from standard herbal reference of National Institute for Food and Drug Control China, NIFDC. As we all know, the global traditional Chinese medicine market size has been witnessing expansion due to increase in pediatric illnesses and chronic behavioral diseases, growing awareness about mental well-being, and rising incidence of lifestyle diseases. This has been driving demand for alternative and off-the-shelf drugs due to added risks with non-traditional Chinese medicine drugs. As the TCM market increasing, the demand for TCM Material Medica identification and standardization is also a must in order to deal with counterfeit merchants or suppliers. Besides, in order to improve analytical method for TCM Material Medica sample identification and standardization, and also for the detection of adulterants and contaminants. Therefore, we need the TCM Material Medica FTIR analyzer. This TCM FTIR analyzer and digital library is an essential reference for researchers and technicians in pharmaceutical and supplement manufacturing industries, especially for routine QA/QC checking, academic research, whereby user can identify the raw materials before proceed with the entire experiment. TCM practitioners and suppliers might use this for identification and authentication about the TCM Material Medica reference standards. And as for regulatory bodies, they can use this as a standard reference and also commercial laboratories for raw TCM material testings. The TCM Material Medica Digital Library contains a total of 573 comprehensive TCM Material Medica reference standards. This library was developed in conjunction with National Institute for Food and Drug Control China, NIFDC, certified TCM Material Medica. The available TCM within the library was listed out in brochure appendix including the reference code, Chinese name, label name, Hanyu pinyin, and scientific name. Before the launching of these digital libraries, we have sent out trial version library to Malaysia local TCM suppliers, namely Wingli, for beta testing. For your information, Wingli is a wholly owned subsidiary of Yurensheng, is a company that specializes in traditional Chinese medicine, TCM. It currently runs more than 230 retail outlets in Hong Kong, Macau, China, Malaysia, Singapore, and Australia. They have 4 factories in Hong Kong and Malaysia. Wingli had provided 84 samples for beta testing. With the first round testing, only 55 samples matched with the TCM libraries. Nonetheless, this unsatisfactory result is due to sample preparation issues. We have requested Wingli to rerun the sample based on the criteria that have been set, and the result is highly impressive, with the rerun batches showing 100% matching with the libraries, and the similarity score is averaging more than 0.8. Next, it will be the advised sample preparation guideline before subjecting to matching with the TCM digital libraries. In order to get a good identification match, we do provide guideline for users to use with the Ftir analyzer. First and foremost, the dried herbal medicine sample must be ground and filtered through 200 particle size mesh. Secondly, the dried herbal medicine and KBR powder must be heated in oven at 110 degrees C for 3 hours prior to the experiment. Third, dried herbal sample mixed with dried KBR powder with a ratio of 1 to 100 and press it into a pellet form. The pressed sample was then placed in the pellet sample holder and scanned in the transmission mode. As for the data processing, there are some spectral requirements and the spectral correction steps required to ensure highest accuracy obtainable. The pellet thickness falls within 0.3 to 0.45 millimeters. As for the spectral correction steps, firstly, convert the spectrum from transmission to absorbance format. Secondly, perform baseline correction. Then, use the spectral region between 2400 to 1800 wave number for arithmetic correction. Correct to 0. Thirdly, save the corrected spectrum as .sp format for library search. For your information, the figure shown here is the example of the spectrum, which fulfill the criteria with more than 60% transmission and the conversion into the absorbance format. Step-by-step sample preparation guideline was available in the published application notes as well. During the process of developing this digital library, we have figured out the causes of poor spectral matching. ATR is not a sensitive enough technique to detect minute changes of the sample. Most of the sample run by ATR would not get more than 60% transmission, as penetration into the sample typically would not be more than 2 micron. The convoluted or overlap peak is usually caused by sample preparation, such as sample inhomogeneity, or the particle size inhomogeneous, which does not filter through the 200 particle size mesh, or the particle size is uneven and too big. Fourth will be uneven distribution among the KBR, powder, and also the samples. Additional requirements for the TCM digital library to be workable include, for final confirmation of the identity of the herb, visual matching is required by comparing the presence of all the spectral peaks, peak positions, and spectral shapes between the sample and reference spectra. The TCM digital library only works with the latest 10.7.2 version of Spectrum IR software. Hereby shows the rerun sample search score results. Obviously, with a correct sample preparation sample that doesn't match well, now it can be identified correctly and the search score has been much improved. This is the overall trial result from Wingley, containing 84 tested samples. The search score in average is more than 0.8, and only one sample is unverified due to shortage of the raw herbs. Brochure was readily available as the supplementary information regarding the TCM digital libraries. Application notes was readily available as well as the supplementary information regarding the TCM digital library with proven field-tested results in conjunction with trial samples provided by Wingley. Hereby listed all the available TCM within the library and listed out as the attached appendix in the brochure and also the application notes. Thank you very much for your kind attention and have a great day.
Thank you, Dr. Oi Kai. Now, we have come to the Q&A session, and I know most of the audience that are listening could not wait for our speaker to answer the question that you have prompted. Once again, we would like to remind all the audience that if you have any question, please list them down at the Q&A box, and we will do our best to answer all the questions. All right, Dr. Oi, there are questions on the floor. Okay, the first question is how Tcm Ftir library assists in the authentication of the TCM's quality.
Thanks for the questions. So, unlike conventional drugs, which have well-defined chemical identities, TCM are natural products. Thus, their quality can be influenced by various natural factors, such as climate, soil quality, processing, harvesting, and extracting, and also manufacturing procedures. In addition, the active ingredients of many herbs are often unknown. So there is still a lack of internationally accepted standards for the quality control of traditional herbs. So for these reasons, it is often difficult to define the quality of TCMs, especially for raw herbs and decoctions pieces. So TCM FDR library can be used as a screening reference assisted with visual inspection for quality assurance of TCM or Chinese medicines. Thank you.
I see. Okay. Another question coming in is that what are the parameters that requires regulation in terms of TCM authentication?
Okay, so at this moment, there is still lack of internationally accepted standards for the growing, harvesting, extracting, packaging, and also supplying of the TCMs, raw herbs, and manufactured products. So one of the reasons is the lack of coordinated international approach plus inadequate information on the chemical composition and active ingredients containing in these products. So most quality control markers and measures as included in the Chinese pharmacopoeia need to be further improved and or confirmed in a way. Then this should be in combination with certain functional and biological data to reflect the overall quality of these commercial products. Thanks.
Okay, thank you so much. And we also have a question on how does TCM FTIR library benefits the suppliers and practitioners in the industry?
Okay, so now the TCM FDR libraries is available apart from the experience alone can be used as a screening tool for unknown herbs or quality control tools via spectral similarity for the review of the drug's efficacy, toxicities, and adverse effects. Medicinal herbs are routinely subjected to complicated scrutiny involving standard tests for the development of pharmaceutical drugs, which can lead to new drug discovery and development. Okay.
I see. Okay. And last but not least, the question is, what is the benefit of using FTIR as an identification tool?
So currently, the most feasible approach seems to employ analytical techniques such as FTIR. Hence, FTIR is a rapid screening tools, and it is non-destructive. And you can use it as a molecular or biochemical markers or functional groups identification to map the fingerprints of the herbal products. So ideally, this should be in combination with functional or biochemical bioassays to monitor the actions of the traditional herbs products. Okay, so it can be used as a rapid and non-destructive techniques. Thank you.
I see. Thank you so much, Dr. Oi. So, so far, we do not have any other question coming in from the platform. So, Dr. Oi, do you have anything that you would like to add on to this session?
Um, not
Or
at this moment.
not at
Yeah.
this moment. Okay, ladies and gentlemen, with that, this is the end of today's session, and we would like to say thank you for joining the session. If you have not visited our Lab Asia Virtual Exhibition Hall, do visit, and don't forget to drop by into PerkinElmer Malaysia Sdn Bhd virtual booth as well. We hope that you will spend your valuable time to explore our virtual platform and start networking with all the industry key players that are currently participating. Also, don't forget to follow us on all our social media platforms for more updates. Once again, thank you so much, Dr. Oi, for being with us today. And thank you everyone for joining this session. Have a great day ahead.
Thank you.
Thank you.